we're about ready to start this night off.
Great.
You think the
This was on the recorded.
Well, good evening, everyone. This is Steve, and I'd like to welcome all of you to Dr. Marvin's Tuesday call, where all the NRF2 activators get together. And one of the things we want to remember is that protandim is not intended to diagnose, treat, cure, or prevent any disease. But you know, I'm happy to say that protandim has been found in 30 different university laboratories to reduce age-dependent oxidative stress at an average of 40% in 30 days, in 100% of the people, 100% of the time. Isn't that good news, Doc?
Hallelujah. It's the good I can hardly stay seated on this chair. I want to stand up and shout. And the other reason I want to stand up and shout is I'm getting ready to go to the 9th Elite Academy coming up in Orlando, and I leave in the morning. I got bells on and ready to go. And I'm going to make Pro 8 this month, so I'm really excited to get down there and get my presentation on the go on Saturday morning. I'm going to do a presentation, and I am so wound up I've given it 15 times this week. I've thought about it and thought about it. I figure it's better to have it firm in your mind when you're speaking to 4,500 people than it is to have it firm on the paper. So I'm not going to use any notes. I'm just going to let her rip. And I hope to activate everyone there, their NRF2 in the process. So hope to see you that are going there, and I'm sure I'll be happy to visit with all of you. And it's going to be a great time. If they get any better, I won't be able to go unless they give me an anesthetic and take me there, because I get so wound up before I go. I can't. I'm pretty near the max. I'm wound to the max. So anyhow,
did you see that article I sent you about the USDA ORAC value, Doc?
yes, I did. If for anybody here that is of any interest to, I want to mention it. The ORAC value that some supplements use, it's now been proclaimed that ORAC values are all inaccurate. Just think about that. There's several supplement companies that blow and go about their ORAC value. Let me tell you.
Tell the people what's the difference between ORAC value and what is the ORAC value of protandim?
Oh, well, it's this way. It's the oxygen radical absorption capacity. In other words, the ability for the absorption of the free radicals. The oxygen radical absorption capacity. Oxygen radical is just another name for free radical. And the ability for a product to neutralize those free radicals. And it works only with ones that are in the serum. Well, that's not good news, because the serum is cleared every 2 hours of any product that's in it. And therefore, it's gone. With protandim, we neutralize 1 million free radicals every second for 13 days. 1 million free radicals per second every second for 13 days. Now, if you can figure out how many radicals that means in 13 days at 1 million per second every second, that would be the ORAC value for protandim. If you could
their advertising claims and all of the statements that they've made to people based on, oh, our ORAC value is bigger than your ORAC value, and all of these things to sell and market their products. And I don't know if I sent you that article, Doc, but this is exactly what the USDA website said. Recently, the USDA's Nutrient Data Laboratory removed the USDA ORAC database for selected foods from the website due to mounting evidence that the values indicating antioxidant capacity have no relevance to the effects of specific bioactive compounds, including polyphenols, on human health. There is no evidence that the beneficial effects of polyphenol-rich foods can be attributed to the antioxidant properties of these foods. The data for antioxidant capacity of foods generated by in vitro test tube methods cannot be extrapolated to in vivo human effects in clinical trials to test benefits of dietary antioxidants that produce mixed results. We know now that antioxidant molecules in food have a wide range of function, many of which are unrelated to the ability to absorb free radicals. For these reasons, the ORAC tables previously available on this website have been withdrawn. USDA.
Well, that's very well. That's it.
I have a question before you go on. I believe you can go on, because we can't write that fast to get that information. I think one can go on to Google and put in USDA ORAC, ORAC, and get that information. Is that true? And did that information come May 16th of this year?
It was first reported removed in May. There's this statement that I read was released in 2010, and the chart was pulled in May of this year. And there's
there is. This is Kathy with in California. There is something about that in the on Google.
Yeah, this is what I read.
Yeah, USDA ORAC.
It's verbatim off of the USDA website. This is not something that is being said by Life Managed Company. This is something that the USDA has published up on the government website.
Yeah, I just pulled it up, sir. And that's great. Thank you very much.
Yeah, spread that out, because there's a lot of supplement companies have got their associates and their distributors believing that they have the highest ORAC value there is. Well, number one, they don't. And number two, the ORAC value isn't that important.
And what's the ORAC value of protandim, Doc?
I don't know, 15, 20 million, I don't know, somewhere along in there.
Well, since it works differently, it's a non-number, it doesn't really matter.
That's right. It's way out of sight. But we know we have the strongest antioxidant that's ever been developed, the strongest anti-inflammatory that's ever been developed, and the safest, the strongest antifibrotic ever developed, the strongest anti-carcinogenic that's ever been developed. And what else do you need? We can't lose with the tools we use. What?
That levels the playing field for the body to function the way it was designed.
Yes, absolutely, 100%. And I can't get over what this will do. So it's like the little boy eating the gizzard. The more I chew, the bigger it gets. So, yes. Okay, is there anybody got any
stories or questions?
Yeah, either one.
Ladies and gentlemen,
I think we have.
Go ahead, Doc.
No, go ahead.
I was going to say, if you want to ask Doctor a question or you have your own story to tell, we ask you to please state your name and where you're from, and you simply have to *6 to unmute yourself, and then please remute yourself so that we can maintain the call quality. And if we have a little number of people that are unmuted, it makes it very difficult.
So I have the first thing that I want to mention. The first thing I want to mention is I want to see if Lonnie is on tonight.
Ronnie, if you're with us, will you *6 yourself, please?
Bobby, are you on? Bobby Womack? to be on. He should be on. Ronnie Womack, are you on? Dr. Marvin, you hear me? Ronnie, yes. Okay, will you tell the people on the call your experience with your neurologist? Tell them what you have and what happened when you saw your neurologist. Okay. I in MS back in 2003, and first got washed. Since then, I've had episodes of extreme weakness in my left side, and I went to rehab and been able to start walking, and then I had extreme fatigueness and weakness, especially summertime in the heat. And I started taking protandim about a month ago, and then the 30th week I noticed I had more fatigueness and critical away had energy. And then I started to be able to walk without my cane. And every day has been getting better and better and better. And so my neurologist, I had an appointment with her Monday. And I went in and I gave her a DVD a long time ago. I told her I was taking protandim and I was doing great things for her, but she hadn't got back with me. So when I had a regular appointment, she had to see me. And when I walked in without my cane, she saw me walking, she was amazed at how change was in me. And so she asked about me, she said, I have not watched the DVD yet, Ronnie. I gave her a bunch of stuff off my bed about how it works. And she listened a little bit. And then she told me, after my appointment was over, she said, Ronnie, I can tell it has helped you so much more than anything else that helped you. I said, well, Doctor, I don't need anything for fatigue no more. I don't have fatigue no more. And she said, so when she left, she said, Ronnie, I'll tell you what, let me have your phone number. And any of my patients that have fatigueness problem like you have, and they cannot find anything to help them, I'll have to give them your number. You call them and I'll put them on protandim. Now tell them people what your diagnosis was, because it was a little muffled. Tell them what your diagnosis was. My diagnosis was they talking about what? Oh, diagnosis with MS? He had MS. So MS, that's what he had. Actually, I've had my first episode way back in 1990, but I was officially diagnosed with MS until 2003. And he looked dialysis since then. And I get to the point that I could hardly walk without a cane. I can't walk at all. I've been pretty rehab hospitals. I was interviewing steroids. And I had extreme fatigueness. And I went and saw my neurologist Monday. And when she saw me, and I told her what I'm taking, she was very amazed by what they had done for me. And when I left, she said, I looked at your phone number, and I'll make sure the patients that have the same problems you have, I'll show them to call you, and you can give them them. So big. That's so good. Thank you so much, Ronnie.
We've got someone with a baseball game on back there that needs to get their phone, please. *6.
Dr. Marvin, Phil Blackburn, New Jersey, I have a question for you. Yes.
Phil, I'm going to bring you back on in just a second. I want to get rid of this baseball game.
Okay.
Okay, Phil, I'm going to unmute here in just a second. I want you to *6 again, please, and come on. We have to get rid of that background noise.
Unmuted. Muted.
Okay, Phil, Blackwell, you want to come on?
Yes, I'm here, Steve. Doc Marvin, I have a friend of mine who has a condition, and I was telling him about protandim, and I told him I would ask you how it would benefit him to take protandim. He's presently being treated. They're running a lot of tests and everything, and what he told me was the doctors actually said he either has pancreatitis or twisting of the stomach, or either a valve not closing. They're not sure. And I told him I would mention that to you tonight to see if it would possibly be able to help him. Yes, it will. But first and foremost, the most important thing is diagnosis. Now, there's a world of difference between a twisted stomach, which is caused from immediate surgery, and its abortion, and pancreatitis. One's an inflammation, the other one's a disaster. I think the doctor's diagnosis is a disaster. All the years I've practiced, I've never used the crude, unscientific term of twisted stomach. If that's true, you should be on the operating table at the time it's announced, abdomen open so he doesn't, encroach his stomach. So that can't be the case. If he's walking around, he doesn't have that. Okay. He's pathetic. Any doctor would give that diagnosis. Now, if he has pancreatitis,
yes, I've known him for years now, and he does have bouts where he has severe abdominal pains.
okay, does he drink?
Not really. Just occasionally, I believe.
Well, drinking a little is like being a little pregnant. You either do or you don't drink.
Right.
And neither one of them's healthy for a person who has pancreatitis because it persists in the inflammation of the pancreas.
Okay.
So this is an anti-inflammatory, and that's why the anti-inflammatory will help any itis in your body.
Okay.
Any itis on your body. You bet. Glad to do it. Anybody else have any gnawing questions or any stories they want to tell?
Dr. Marvin?
Yes.
This is Kathy again from California, Doctor. Then whatever you said about that, colitis, diverticulitis, and diverticulosis would be, the supplement would help that particular diagnosis.
Now, the problem with diverticulosis, what?
Hello?
The problem with diverticulosis is that's an anatomical problem of the colon, usually the latter portion of the colon, with little outpouching sacs that get infected. And that's the diverticula, which is the Latin for sac, and itis is infection. It will help the inflammation, help the infection, and prevent, hopefully, a perforation or a need for surgical intervention.
Okay, great. Thank you.
You bet.
Dr. Marvin?
Can you hear me?
Yes.
Dr. Marvin?
I was going to be talking at exactly the same time.
Sorry about
Can
that.
you please go first?
This is Melinda from Liberty Hill, and I had a quick question about a young friend who's 16. She has been diagnosed with Graves' disease, and the doctors, parents would like to put on protandim. Doctors want to do radioiodine, I guess, to get rid of the thyroid completely. And
That means that he'll have to take thyroid for the rest of his life. Well, I tried something else before I did that drastic maneuver.
Okay, so one protandim a day.
Yes, I tried that at least. Because it has helped some people. And anything you can do to prevent the lifelong ingestion of a medication, I'm all for that.
Okay, thank you very much.
How long would you say that situation, Dr. Marvin?
3 months.
Thank you.
Dr. Marvin?
Yes.
I would like to ask you a question. What is protandim's effects by turning around Alzheimer's, bipolar, and
We've got a CD on kccopyshop.com that will tell you the case history of Alzheimer's. Alzheimer's was diagnosed in 2010 by the University of Case Western Medical School in Cleveland to be due to oxidative stress. We have the only product on the globe that effectively reduces oxidative stress without toxicity. Now, if we have the only product, and that's what causes Alzheimer's, does that make any thoughts in your mind you might connect those two? I would.
okay, what is that CD again, and where do I get it?
It's Case Western Medical School. I believe where did we get that, Steve? Was it off of PubMed.gov?
Yeah, it's off of, it's an October 2010 study that was published by Case Western Reserve University on Alzheimer's, and I can't think of it. I don't have the title of
Okay,
it.
that's fine. I want to tell you about all that. Okay.
about it, so I'd give it to them ASAP.
Right. Gotcha.
Oklahoma City?
That's some studies on AIDS.
Yes, there's studies on AIDS.
Thank you. That's all. Thank you.
Oklahoma City?
Yes, go ahead.
How beneficial is this, sir, for diabetes? Type 2.
Type 2 is quicker than type 1.
So
Type
is
2?
it beneficial?
It's what official.
Protandim for diabetes.
Well, you probably can find a paper on it. There's been several people here on Tuesday night that shared with it. And I've got several people that's off of everything but protandim.
Okay, this is my first time calling in. That's the reason I'm trying to seek this
Well,
information.
check on my website and listen to the calls, and you should find some evidence in there.
All right. Thank you, sir.
Doctor, you know what my website is?
No, I don't.
How are you going to watch without it?
Well, I was going to get the person that had been giving me, she started me with protandim, and I imagine
I'm
that
just
she was...
kidding you, ma'am. I'm just kidding you. www.docmarvin.com.
All right. Thank you.
And ma'am, let me pass this information. If you were to search for oxidative stress and diabetes on PubMed, the government website, you'll find 8,388 medical journal articles that tie those two together.
Wow.
There's an ongoing study in Minnesota on type 1 diabetes that's been going on for 7 years, and we're hoping it'll be finished up in the 8th year, of the benefit of protandim in that study. So, very favorable is the best you could say, because it's not published yet.
Thank you. That's very exciting. Thank you, sir.
It's all exciting. I looked up, yes. Yes. Can you tell me, protandim would be useful for somebody who's been on antidepressant medication for over a decade, and this person wants to wean himself off of it under a doctor's care? How would protandim benefit the person in that respect?
Sir, what is your name? Where are you from, sir?
I'm calling from Montreal.
Montreal, okay.
It would be wonderful, in my experience. And you could probably check that on PubMed.gov.
Dr. Mark.
You know how it would be, what would be the regimen that the person would have to be on? It's real complicated. It's one pill a day, in the morning, with food, with a little fat, and drink plenty of water. That's it. That's it. But the biggest thing I'm concerned about is that he doesn't wean himself off all these antidepressants, because you'll get a rebound. So he has to have his doctor help him wean off if he's taking them that long. Oh, absolutely. He wants to do it under his doctor's care. Okay. So a pill per day. Well, what about the withdrawal reactions? Well, if he has a doctor do it, he shouldn't have any. Why? Because the doctor can prescribe something. The doctors know which ones will cause rebound and which ones won't. He doesn't know that. Therefore, I know that this person is scared to death of akathisia, I think it's called akathisia. He tried it a couple of decades ago, when he was on a different antidepressant, and he was under stress at the time, being married and everything like that. But so he crashed, and he had that withdrawal reaction, which is real out-of-body experience type of thing. When his doctor weans him off, he should avoid that. Okay, good enough. And I want to mention, as far as stress is concerned, when I got married, I relaxed like a slug. Depends who you're married to. Still relaxed.
Dr. Marvin.
Yeah, and there's a number of references and calls where we've had a lot of stories of people who've successfully seen relief in this area. You may want to check with Karen, and she'll have some of that information for you later.
Oh, thank you very much.
Okay.
Okay.
Dr.
Go
Marvin,
ahead, ma'am. Yes.
this is Gina Barone out of Auburn, Indiana. I've come across the lady that I would genuinely really like to help. She has many, many problems. She's currently in the hospital. She has Crohn's, and she has an autoimmune disease, and they are checking.
Crohn's is an autoimmune disease.
Is it the same?
Crohn's is
Okay.
What else do you have?
They said that they're checking for lymphoma, leukemia, or a blood disease, and I thought, aren't those the same?
No, lots of the treatments that the people now get from allopathic medicine, which I was a part of for 55 years, creates lymphomas. And that's why they want to check for one, because if they've been treating her for Crohn's, she well may have a medication-produced lymphoma. Not a good outcome.
Yeah. She said she has no colon in her. Sorry, go ahead.
We have very, very, very good results in helping people with Crohn's.
Well, how would you suggest, because she says she has no colon, and they just the other day removed a small part of her intestines, and she was taking PPN for a time, but she had a reaction and was red and blotchy and itchy all over, so they removed that, or stopped that. So if she has trouble...
My comment is this. She only has a little bit more intestine to donate to medical science. Because pretty soon she'll have a connection from the end of her stomach to her rectum.
Mm-hmm.
If she doesn't take something that will stop Crohn's, and nothing she's getting is. She better change horses. My grandfather told me when I was a 9-year-old boy, Norman, if you're riding a dead horse, dismount. She needs to dismount from those surgeries and get on something other than that, because once she's given her colon, she doesn't get another one. And once she's given all of her small intestines, what?
She can still process it then, right?
She needs to, I can't understand your question.
Her body will disintegrate the pill in the stomach then, right? And she can't absorb it. Just because she doesn't have a colon doesn't mean that she can't absorb it. Is that right?
That's right.
Okay. Excuse me, Dr. Marvin?
Yes.
I have a gentleman who is in that same situation that she's talking about. He has no colon, and he is doing amazing. He is so happy. He feels wonderful. He doesn't have the stomach extension what they normally have, and he's assimilating the pill wonderful. And, he's doing great, so that helps to encourage you.
Dr. Clark. Lady, did you have any other questions?
No, that's it. Thank you so much. I'd love to have his name, though, if I could get in touch with him.
Go ahead.
I don't know how to go about it. Yeah, well, you'll have to get a hold of me, Karen, at 559-240-8695, and then I can connect you. Okay, great.
Right.
Thank you.
Rather than bothering him, go through my calls and you'll see many cases, ma'am.
Okay.
Okay, doctor, it works.
It works, okay. Dr. Marvin.
Hello? Yes, go ahead, sir. Where are you from? I'm from Orange County, California. I'm calling on behalf of my wife. I'm 85, she's 83. We're in perfect health. My wife, she had everything, all the CAT scans and you name it, and she's had it in the past 5 years. And I think it's because of the fact that we had lost 3 of our 4
boys, and there was a Lord. But, and the last one was just 7 years ago, and he was 41. Now, the problem is with her, she was in emergency 5 different times in the past 7 years, and they couldn't find a thing wrong with her, not a thing. Because she has a strong heart, good kidneys, and she could go on. However, the one thing, she is very, very weak. She gets dizzy. Her legs give out on her. And is there anything that can be done about that? I don't know whether it's, anything psychosomatic or whatever. I think it's losing the children or what? I think it's post-traumatic stress disorder from losing her children. Post-traumatic stress disorder. And this works wonderful for her. Oh, it does. Protandim does. Okay, so I'll be in touch with you after the program's over then. Okay, guys, bye now. Okay, thank you.
So this is Dinah in Vegas. I'm one of the twins, you know me and Allison. Anyway, it's time for a story. I have a friend, her name is Christy Heller. She has MS. She's had it since, I don't know how many years, but I've had it for about 11 years. And about 7 years ago, she became blind. She sees shadows, and she does not see well. She carries a cane. I ran into her one day and decided to talk to her about protandim. Anyway, she got on the product. She couldn't get on it fast enough. And one day in, a blue haze that she experiences in the daylight that actually causes pain and is very annoying, and she has to wear these glasses that have special tints to them to stop the blue haze. That went away after the first day. On day 2, she in the daylight, she experiences pain aside from the blue haze. She experiences pain even wearing her glasses. Well, day 2, she's outside not wearing glasses, not in pain, no blue haze. Day 3, the color that she lost 7 years prior is coming back. Day 4, colors later. Day 5, she can now see her daughter. She doesn't see her daughter like shut up images, but she sees her daughter, and her daughter has eyes. And day 3 also, depth perception is back. She once she became blind, she did not have depth perception, and when she would see someone, they always appeared farther. And now she can tell you whether you're 1 foot away, 2 foot away, 10 foot away, and she's got that back. I went with her today to see her eye doctor. He's a specialist for eye problems, especially people with diseases and diabetes and whatnot. And he saw a dramatic improvement in her vision. And we then introduced him to protandim, and he called her his little test project. So he's going to keep an eye on her, and he's also looking into the product. So it's wonderful, and it's exciting.
Yes, and we should label this, Steve, MS. Right. Tremendous testimonies about MS. Ma'am, I am so thankful that you've got it on here and we've got it recorded. Some way we've got to identify this.
I was hoping she'd come on the call. I'm going to try and invite her maybe the next week, and maybe we can talk. I'll let you know if she'll be on there.
Will you email me after the call so I can connect with you? This is Steve. Email Steve at Kelsay, KELSAY.US.
And that's
Wait a minute. Oh, go ahead, Steve.
Yes, that is Steve at Kelsay, KELSAY.US.
Got it, Steve. I will email you my information.
That way we can connect on this. Okay?
All right, thank you.
Doctor, it's Montreal calling again. My friend is on chronic bleeding. He's one of the ones to get off of his antidepressants. He's on effects, sir. How long do you think he needs to be on protandim before he and his doctor tries to get him off of the effects, sir? Well, that's been at least a couple months. bunions on tonight? Hello, Dr. Marvin. Dr. Marvin, are you the one with the bunions?
I got Martinez and
Okay. Will you tell your story about your bunions?
well, it doesn't sound as serious as what's coming in there, but yes, I will. You know, everybody, I don't know how many folks across North America have a bunion or two, but bunions are a very painful, agonizing thing whether you're in a crowd or by yourself. And I've been on protandim since the 1st of March. First of all, in 2 3/4 months, I got rid of leukemia. I did that one. And now I just noticed here the other day, I had a bunion on the left and a bunion on the right, and they're almost gone. Anybody with bunions, this is a bunion story.
It's a great bunion story.
Well,
Is it protandim help the leukemia?
I got rid of my leukemia.
Amen. That's what I want to hear.
For any treatment or anything, I wasn't on any meds or treatment. And my blood specialist in Peterborough, Ontario in Canada, he just shook his head. He said, I don't know what you're doing, but keep doing it. I can't find leukemia in you anywhere. How long have you had it? 2 years. Thank you. 2 years.
Which kind was it?
Treat the tip of my tongue, I can't say it.
Lymphatic leukemia, myelogenous leukemia.
Go on with your call, Doc Mark, and I'll come in a few minutes. I have it written in my wallet. Hey, I'll
Doc, yes. Well, for that, sedation sense also, like a boil? I haven't ever used it for that. Usually if you have an infected cyst, you don't need protandim, you need a Barker knife to open it. She did that. That was a dermatologist, and she squeezed the thing out, most of it. But you can't only come back unless you take the capsule out, the root, right? She told me that she'd have to refer me to the capsule. It has a round capsule. But she also told me that even taking that out, there's a 20% chance that it'll come back. I never had any problems with it because I always got all of it. I've taken several hundred out of people from the top of their head to the bottom of their feet. You can have them anywhere, but you have to have all the capsule, and it's a certain technique of taking it out that they'll never come back. Really? She told me that she would have to refer me to a plastic surgeon to take it out. Well, if it's on your rear end, you don't need a plastic surgeon. It all depends on whether it's on your face. No, it's on my chest. It's on my chest. Will you go around with your chest bare for people to see? No. Well, then I wouldn't have a plastic surgeon take it off.
Dr. Marvin?
Yeah, go ahead.
Dr. Marvin, we have Gretchen here from Idaho who's had a lot of significant inflammatory process. Thank you.
Yes, I was experiencing pretty intense pain for the last couple of months, and it's been my first round of being in allopathic medicine, and seeing a heart specialist, etc. And I was given high doses of indomethacin and ibuprofen before that to try and they said I had
What was your diagnosis?
pericarditis and pleuritis. But she said it was atypical because I had such high levels of inflammation. Both C-dimer and C-rate were very high even after taking these high doses of anti-inflammatories. And I decided to try it that way because I was in such pain. And now I started protandim a week ago and stopped it. He said I could stop it. And then it started coming back. And I also have inflamed gums. I've had gum disease chronically for years, which I know causes inflammation. So the trouble, 3 of my ultra doctors, why I have such high
inflammation rate. But the implant. How long have you taken protandim? A week. 1 week. Haven't taken it long enough. Okay. And it does work on periodontal disease. It does, because what happened was when I stopped the endomethacin and started taking it, the pain and the inflammation in my gums came back, and someone suggested it might be a detox reaction. Could be. But I usually don't stop the endomethacin until I've had it more than a week. So continue to take, I wasn't sure about that, so continue to take the endomethacin as well as until you give the protandim enough time to do something. And how long would that be? It all depends on you. Until you get some results. This works 100% of the time and 100% of the people. The time is all relevant to the person. Well, that's really exciting. So at least a month, probably? Oh, yeah. That's your life. Dr. Yep. Dr.
Hi, Dr.
Marvin.
And in Canada again.
Oh.
It was chronic.
People were talking all the time.
Canada, what was the leukemia that you were...
The leukemia was chronic lymphocytic leukemia.
That's what I asked you, was lymphocytic leukemia. Okay, that's great. How long? 2 years? How long did it take you to get rid of it?
I had it 2 years, and it took me from March the 1st, and so halfway through May.
Halfway through May. Wow.
Gone.
2.5 miles. Well, I tell you, this night's going to be a great recording, Steve. Well,
And in 4 or 5 months, my onions are almost gone. So there you go.
you're going to be dancing till the wee hours of the morning.
I'll be up all night, yeah. Everything's a smile now. Okay, thank you.
Every day is a day with sunshine. When you're making protandim.
There's a gentleman in the Sussex in there, Doc.
Yeah, I know it. Yes. Dr. Marvin. My name is Dwight. I'm in Sarasota, Florida. This is my first time on the call. And I was diagnosed with terminal cancer December of 2009. But I had got rid of it from taking herbs. I had a tumor that they had to cut off my chest. On the left side of my chest, it was the size of a large cabbage. And so they cut it off for cosmetic purposes. But what kind of a tumor do you have? What's your diagnosis? Well, I have it in the spine, the brain, so what is the origin? They call it breast cancer. I don't know. But you had breast cancer? Yes. Yes. Did they take your breast off? They took off my chest. They took off my left one because it was the size. My chest the tumor had grown over the years. It grew to the size of a large cabbage. What were you doing while it was growing? Well, it grew mighty quick. I didn't know what was going on. I thought it was glaucomate. And you thought it was what? Glaucomate. You know, when a man don't get enough estrogen. You call it about gynecomastia? Yeah, that's what I'm trying to say. I've never seen gynecomastia bigger than a baseball. You had one bigger than a large cabbage. Yeah, but when I found out, there were several things going on. One, I didn't have insurance, and when I did have insurance, the doctor told me that I just needed to exercise, and I did. I did exercise, but I was still losing muscles. And it's like the more I exercise, the more muscle I lost. Of course. So I think I changed doctors. Yeah, well, I did. That was in 2002 or something like that. You I realized he didn't know anything much. Anyway, so now this tumor, since they had cut it off, I had also had they had to cut the tumor off my spine. I had a tumor on my spine that caused my legs to go out, but when they cut it off, they came back. So I praise God for that. But the tumor that they removed from my chest since February till now, it has grown back on, but this time it's open, and it's about the size. It's probably 3 inches in diameter, 2.5 to 3 inches in diameter, and it's open. And what they gonna do with that? Well, what they want to do is use chemotherapy to shrink it and then cut it out and then probably hit it with the radiation. But I don't want to use chemo. I was trying to find another way. I had been using some rich green clay, and it made it get flatter, but I don't, so you taking protandim? No, sir. That's why I was calling to find out, well, after taking it, sir, I would get to taking it as soon as you could get a bottle. Okay. If you take it for a month, then go to 2 a day. Okay. Yep. Okay. All right. And you think that'll I think it'll help. Okay, I think it'll help. They was wanting me tomorrow. I'm supposed to go to the doctor and talk with them, and I know they want to do this chemo, but I just don't trust them like that. Yeah. Okay. Well, get a hold of somebody to get the product. Get on it. Maybe they'll even loan you a bottle. You can pay it back later, but I'd get on it ASAP. Okay. Now, one more question. Brain tumor. They said that I have a tumor in my brain, but the herbs I was taking, I still take herbs, and so will that it help that too? It should. Okay. Drink plenty of water. Yes. Well, hey, one more question. Yes. One more question, please. I have a brother that about 25 years ago, he lost the use of his legs. I mean, when he walks, he drags his legs. He crawls most of the time when he's in his house. They say something with his nerves, but he can't stand himself up. And if he walks, he can't walk unless he's holding onto a cane or something. And he has an accident. What's his diagnosis? He didn't have an accident. He said that they told him it was some kind of nerve. Okay, nerve. Get him on it as fast as you get on it. Okay. All right. Thank you. You got to come back. Thank you. Dr. Mike, next week and talk to us. Go ahead, sir.
This is Mike Miller, in Atlanta. I had a question. One of our pastors is 24 years old. He has had problems with very irregular heartbeat, and he has had several procedures where they've run, I don't know if it's a laser or something. It's ablation. It was called ablation, yeah, that's what he said. And he said, I think this 3 times and doesn't seem to work. But I'm wondering, well, would the tandem help that? In terms of the cardiac issues and vascular issues. Right. A number of things on these calls or at previous months and so forth, talking about irregular heartbeats, valve issues, pacemaker issues, and overall we've seen, a lot of positive results. In general, Mike, I would certainly, if that's your pastor, I would make sure that he was taking the pill because there's far more aspects of his entire being that need to be addressed. Every person that has a pulse has oxidative stress problems.
Yeah, well, I understand that, and I have talked to him about it, but I wanted to,
I want you to turn the tables on him. Say, Pastor, doesn't the Bible talk about your responsibility of temple tending, Pastor? Which means you need to take care of the temple that you are walking around in. Turn the tables on him, Mike. Here's Dr. Marvin.
Okay. What was the issue? The pastor didn't want to do anything? Well, I just recently talked to him about it, and he was going to look at it, but of course he's under care of doctors, and he's had the birthday is, he's had 3 of those ablation procedures, and they don't seem to be correcting the problem. I know some experts that never did it twice. It's how good the person that does the ablation is. It's very technical. It has to be very specific. But on the other hand, 2 weeks ago we had a person who his irregularity stopped on protandim. He didn't even have to have a area burn. Okay. You can burn a little area on the inside of your heart when they do an ablation. If you weren't an expert, you had not to be doing it. Okay. Well, thank you. Yes. When you burn the inside of your heart, you're living kind of close to the edge. If you have somebody that don't know what they're doing and has to do it 3 times, that isn't a good course to sign up for. That's right. Well, thank you. Okay. Einstein said, folks, the definition of insanity is doing the same thing over and over, expecting a different outcome. Yes, ma'am. What can I do?
For elderly people who have Alzheimer's or really anybody who has major health problems, I just heard you say that after a month they could take protandim twice a day, 12 hours apart, for like 2 weeks. Can they ever take it for longer than that? Like, could they take it continuously twice a day?
Yeah, but you gotta know what you're doing. He said, you grouped all old people into one. Now you're talking about Alzheimer's or just old people?
Well, my first concern is elderly people with Alzheimer's.
1 a day.
And never go to 2 a day?
Yeah, you can. After a month, you can do it for 2 weeks, 1 twice a day. But you're given plenty of time to detox, or you're going to have a sick person.
Now, they have already been on protandim for, more than half a year. And so if they went to twice a day...
Are they taking it in the morning? Are they drinking 64 ounces of water a day? Are they taking it with some fat?
Yes, they are. They are.
Sure.
And they did take it for twice a day for 2 weeks. And I saw, this is my parents, and I saw improvement. I just wondered, could they continue for even longer to take it?
It's possible.
Could they do it for, continuously, forever?
Well, whatever it takes. We don't know whether it'll be forever. I had a man wake up and 1 pill a day in 9 days.
Oh, wow. So maybe if they...
Everybody's different.
Okay. So maybe if they took it twice a day for a couple of months and then maybe backed off back to 1 a day.
You have them take it with some fat in the morning. Take it early in the morning with some fat and drink 64 ounces of water per day.
4 ounces. All right. Have you had any experience with small animals like cats? Would they take more than
that experience? We had 2 nights. That's all we talked about on this call. And the company's doing the research right now with the veterinarian that concerned, and they're going to come out with a pet property.
Because I'm so excited about that. I'm wondering, should like a cat take maybe a third of a pill a day?
Well, it depends on if you've got one like Winston Churchill who weighs 30 pounds, you may want more than a third of a tablet.
No, these are little cats, maybe about 10 pounds.
Yeah, I'd probably give them a third.
Probably a third. All right. Okay. And can they take it twice a day continuously?
Don't need to. I've never seen one that needed to.
Okay.
Everybody wants to get more of this. You don't need more. In fact, after 3 tablets, you get less results than you do with 2.
Oh, okay. Okay. All right. Thank you so much, Dr. Marvin. I appreciate it.
Okay.
Dr. Marvin, my name is Shirley, and I am Dr. Shirley Henderson from Canton, Ohio. I am on medication for high blood pressure, cholesterol. My HDL is too low. The LDL is high, and I have.
How high is your LDL?
It was 171.
How low was your HDL?
I am sorry, sir, but I don't remember that. But I do remember the report from about 6 months.
Are you on one of the statins?
Credit CE, Lipitor.
Lipitor is your statin? Okay. Are you aware, ma'am, that since December of 2011, there's 3 papers showing that statins, of which Lipitor is one of, is the cause for cancer?
I am not aware of that, but I am, I report other terrible side effects, and really that's why I'm asking for questions.
Okay. It lowers your blood sugar, your blood pressure, and your blood cholesterol. But what I would do, if I was you, you consider this, red rice yeast, or red yeast rice, is much better than any of the statins to lower your cholesterol.
Oh, I wasn't aware of that.
Yes.
Right.
You can call me. I'm going to be flying tomorrow about 11, so if you call me before then, I can tell you more about it. But you can buy over-the-counter red rice yeast, 600 milligrams twice a day. I lowered my cholesterol to 106, and my LDL was 32.
Wow. Okay.
And my HDL was 54, I believe. It's much better than statins. Statins have been shown to cause cancer and dementia. Oh.
Now, that was my next question. I am suffering the effects of memory loss. And
Are you on protandim?
yes, I am.
How long you been on it?
I've only been on it, actually, it was a month, and then I went off of it negligent due to that, but I am now back on it.
Why'd you go off of it?
I have a foster daughter that was diagnosed with colon cancer, problems with her spleen and her spine, and I was just, what can I say,
Well, if you go to the if you will go to the 9th study on my website, you'll see where the University of Colorado said this will reverse colon cancer.
All right, I will do that. And is there anything in protandim that you believe may retard the memory loss effects?
Yes. Ma'am, I just said a while ago, I've woken up 6 Alzheimer's that are now talking with their families. Did you not hear that?
I did hear that, yeah.
That answers your question.
I don't have enough knowledge about Alzheimer's that I would, be able to relate that directly to my
It's a severe dementia.
Memory loss.
Memory loss. So there. Keep coming on Tuesday nights and we'll tell you about it piece by piece.
Okay.
We appreciate you coming, and if we give you too much info tonight, come back and we'll give you a fill-up next Tuesday night.
Dr. Meyer. Thank you. Thank you, Dr. Mark. Go ahead. I'm sorry. This is Dorothy from Boston, California. I was invited by N.A. I wanted to find out, I also have the same problem she has with the LDL, the high cholesterol, but I have high homocysteine, high triglycerides as well as cataract and high blood pressure. But I don't take any statin drugs because I know about all of them already.
How long have you taken protandim?
I have not started tonight. The first night I was invited on the call by Ian Baines out of Georgia.
Okay, there.
Will it help the homocysteine, triglycerides, and the
It'll help all that. It'll help all that. Including the cataract.
including the cataract?
Okay. One lady in Fredericksburg, Virginia, that cleared 2 cataracts.
Oh, wow.
Hallelujah.
Thank you very much. I appreciate that. Dr. Harvin?
Yes, go ahead.
Dee Kahn from Tampa, Florida. I need some input. I've got a friend whose father, 77-year-old male, had a stroke a week ago today, actually. Doctor said it was a small one, but it was a protandim stroke. I'm not sure if I'm pronouncing that right.
Yeah, I know what it is.
Protandim. Okay. I know that Harvard is doing a study on post-stroke and how it relates with protandim. Could you speak a little bit about that for me?
Well, we don't have the report yet. We will momentarily. But I can tell you this, that a medical school will not do research on something they have evidence that it will work, and they did the research to prove, without a doubt, that that is the truth. So on that alone, and the experience I've had, I would get the patient on one a day.
Okay. What exactly is that protandim stroke?
It's a certain area of your brain.
They said it was down by the brain stem.
Yeah, it is.
Okay. Does that make recovery,
Doesn't change much.
Okay. So just one a day for him would be well worth it. Okay.
Right.
Appreciate it. See you, Dr. Marvin. This is Chris in Omaha.
Yeah.
How about Candida?
Well, we've had several people, and it all depends on where it is. If it's on the skin, you put the science on it and take the pill. If it's in the inside, you take the pill. So where is it?
It's on the inside.
Is he diabetic?
I'm diabetic, yeah. So,
Okay. Diabetics are the main ones that have it on the inside.
okay. That's what I wanted to know. So, okay.
And this works in diabetes. This system. You're sure? Okay.
Dr. Marvin, this is Boyd Bland in Joel, Kansas. How are you this evening?
Good.
I have a disorder right friend. He's 92. That has pretty severe macular degeneration. And I have another question in a moment. Will protandim help with the macular degeneration?
We have a lady in Fredericksburg, Virginia, that our ophthalmologist said she cleared hers completely. Now I'm going to try to find out in the Elite Academy I'm leaving for tomorrow from Kathleen O'Brien if she knows who that lady is. Because it was one of my first calls and I didn't get her name.
The second question I have regards 2 of my children. We have in our family, no history outside of a great uncle of my children that had epilepsy. And 2 of my children have a neuroxin. I don't know what drug they're on, but they supposedly have to take it the rest of their life.
How many seizures have they had?
actually had, to my knowledge, more than our staff. And
How many we talking about?
over the last several years,
John, how many seizures has John Henry had? You know?
well, what? He doesn't know for sure. They've had numerous seizures.
But this is works very well. How old are they?
About 38 and about 33, 34.
We've had real good luck with assisting people with seizures, and particularly in children. But they aren't children, they're adults. But it's harmless and doesn't interfere with what they're taking. Are they on seizure medication?
Yes, they both are.
What are they on?
I do not know the name of the drug.
Okay. Okay. All right.
I know you know what the drug is. They're on two different kinds of medications. So our daughter has a wave, and our son lives here. They're close to us.
Okay. Well, doesn't make much difference. I'd just go ahead and give it to them one a day.
Thank you
It
very
doesn't
much.
interfere with their medicine. The medicine doesn't interfere with protandim.
And it might help for some unknowns out there too that they may have. Thank you very much.
You bet. Anybody else?
Yes, this is Sarah calling you from Oklahoma City. I have two questions, doctor. I have arthritis in my back. I'm the one that called with the diabetes, and they're fused at the bottom. Can't explain it any better than that. Would protandim help with that? I'm awful pain right now, and I have been
That's helped an awful lot of people with joint pain. Many people.
Okay. And I've been on it. I've been on it now for almost a month, once a day. And I have been noticing some help. The next thing I'd like to know, how about gout? Would it be helpful for gout?
I've had several people say it is.
Okay, I know eating right would probably help along with that.
That's very important.
Yes. Thank you, Dr. Martin, very much.
Okay.
Dr. Martin, may I please ask Shirley Henderson again from Ohio? The foster, I call her foster's house, she really is that has colon cancer. She is 40 years old. She has mental retardation, and she has seizures that when she came to me, the neurologist told me were unnamed. I am in my car. I don't have the list of the meds she takes. She's on 7 meds twice a day. Are there any medications that protandim cannot be taken concurrently with? Can I just give it to her? No, sir. Okay. Dr. Marvin?
Yes.
Joyce Barna from Cleveland, Ohio. I have a nephew who has an abundance of canker sores, and nobody can ever really help him or give him anything to help them. Do you think protandim would work?
Yes.
Yes, because it raises his immunity.
And that's what he needs to clear that up.
Yep. Is there
And
any?
would take the normal 1 pill a day.
Right.
Okay, thank you.
You bet. Well, Steve?
Well, I think we're kind of past the top of the hour here. We probably need to call it a night, Doc, don't you think?
Dr.
No,
Marvin?
I did it. Let's go one more time. I just want to ask you about a friend that has the radiation poisoning from being, I guess you can say, close to Chernobyl when they had the accident. She's 49 now, and she was about 500 miles away from Chernobyl when the nuclear disaster happened. But she's always tired. She can't take iron. It doesn't work for her. Doesn't agree with her. Good protandim. Take iron? No. Okay. Yes, we have 4,800 articles showing that protandim, will work because it's the oxidative stress. Radiation sickness is oxidative stress. Well, about the radiation sickness, I asked Dr. McCord personally, and he said, yes, it works excellent.
One pill a day or more?
One pill a day.
Okay, we'll get her on it right away. Okay. Yes, ma'am, okay. Yes.
Yes, Dr. Marvin, this is Jeanette in Atlanta, Georgia, and I just have really a praise report. My sister is a retired detective. She's been on the force for many years, but after she retired, she of course began to get some health ailments, one being gout. She's been swelling up something terrible. She couldn't raise her arms above her head. She couldn't turn her head without any pain. She was constantly going to emergency at night. She couldn't sleep. The swelling was so bad. But I sent her a bottle of the protandim 2 weeks ago, and on the second day, she called me so excited. The pain was gone. The swelling was gone. She was able to raise her arms. She was able to turn her head. And she's just so excited. And I just want anybody out there, if you have any doubt about this product, don't. Because this is so phenomenal. This is a blessing from God. This is an opportunity that we can be a witness through the people that we love and care about. We've got to get this message out to everybody as quick as we can. And I am just so excited. My sister is telling everybody about it. In fact, she's given a few other people who've had similar ailments some of her pills, and she's ordering more, and they are starting to order. So I don't know if she's on the call tonight. The schedule is a little crazy, but I'm excited about what's happening. I'm excited that we can make a difference by working together and having this line on Tuesday night to share with everyone.
How long did you say she was on it, please? Like, how long was she on it before she got these results, please?
She was on it 2 days when she got it. So she was saying with
48 hours.
Down 48 hours. Not Marvin.
Now, Michael Perry from Minneapolis. Go ahead.
Could you address, wake up in the morning with, my father passed away last year from prostate cancer. His brother died from prostate cancer. My grandfather did. Could you speak on prostate health and protandim? Any information you have on that?
Yes, you go to the website, kccoffeeshop.com, and there's a case on there of prostate cancer.
KC is in
Kansas City.
Yeah, okay.
Coffeeshop.com.
Coffeeshop.com.
There's a available CD that you can order there that tells the whole story about prostate.
We sell all the CDs at cost.
Okay, awesome. Cindy, thank you. Okay, thanks a lot.
Dr. Marvin, if I call you tomorrow, what number should I call you at?
816-392-6498. The earlier the better. But not earlier than 8 o'clock Central. 816-392. It's on the website.
On DocMarvin.com. Doc Marvin's website on the contact information is up there, and his phone number is there, and his email. And so it's DocMarvin.com. C-O-M.
392 and then
6498.
498. Thank you. Dr. Marvin, my sister is taking protandim, and she's wondering whether she still needs to take collagen. I don't know what. No? How about, okay, what about Coltrane?
Caltrate and wood, because that's for women to prevent osteoporosis.
Okay, so that's the one to take then.
Yep.
And what about vitamin C and vitamin D?
No, there's no need to take vitamin C, and Caltrate has plenty of vitamin D in it.
All right. Okay, fine. And I know you told me that you should still take the fish oil.
Yes.
Okay, very good. Thank you so much.
You bet.
Okay, hi, Darvin. This is Linda.
Yes. Yes.
Hi. I'm the pharmacist, and I hadn't talked to you. So I don't want to take all the time, but I was going to give you a 2-cent update
on my progress. I've now taken protandim for a month, and I didn't even realize until I was listening to this call that I haven't had any more infections whatsoever in my gums, and I actually have an appointment to go see a gum specialist. That was pretty good.
Yeah.
The other thing the other thing that has happened that was wild was I was called jury duty after I'd been on the medicine about 2.5 weeks. I ended up having to park at the top of the structure and walk down 7 flights of stairs because they wouldn't let me on the elevator. We walked to the courthouse. I have osteoporosis of the right knee. I forgot my cane, which I normally carry, and I went over to the courthouse, did my thing, came back, got a little horsey and got in it right up the elevator to my car. Got in my car, that's a total of 4 city blocks of walking. There was a couple of more issues where I had to go up and down another flight of stairs. So 9 flights of stairs, 4 city blocks. I'm somebody that couldn't walk a city block with the cane without being in agony. Got back in my car when I finished, stopped for 2 more errands, and when I got close to the house, I thought, I think I'm going to go get some groceries. And I went around, and on the way out, I was asked if I'd had my knee joint surgery. And I said, why did you say that? He goes, well, you're not riding the cart. I haven't seen you without that cart in over a year. I almost passed out. It works, and the next morning I woke up and I thought I was going to die. But what was shocking is all those muscles I had been using going up through the and it wasn't my knee. I mean, and I worked through it, and within 4 days it was like, overdoing the gym or something. And I haven't used the cart at the grocery store now in almost 2 weeks. And
we're getting ready to start a pharmacist call.
Yes.
Well, we want to have your email, so email me.
I will.
You're okay. You're going to have to get with Karen and get ready to rock and roll.
Well, I wanted to talk to you if you have 10 seconds
We'll talk. We'll talk.
Ready to rock and roll. We finally getting it ready here.
Okay. We'll talk after the call.
That's great. Bye.
Okay. Bye.
Dr. Marvin?
Yes.
I'd like to know, how to take
So let's see it.
Yeah.
It's not a good course. Number 1 is due to doctors prescribing too much antibiotics.
Okay.
That's what causes it. And then they develop C. difficile as a result of over-prescribing antibiotics. And it can be horrid. There's 2 things that I do, and I'll just tell you what they are. One's probiocil, and the other one is protandim.
So, how much protandim should I take?
1 a day.
1 a day? And what was the other thing you told me to understand?
P-R-O-B-I-O-S-I-L.
And what is that?
It's nano silver. It will kill the infection without having any more antibiotic effect.
Okay, thank you very much.
You can call me maybe day after tomorrow and I can tell you.
Thank you.
Okay, bye-bye. Well, are we about run this chicken's neck?
I think we need to call it a night, Doc. We'll be on next week, and we'll again talk about this marvelous product called protandim, and let's not forget about True Science, that marvelous topical that I wouldn't be without. Here it is.
Doc, one quick question. What? Dialysis. Have you heard anyone getting off of dialysis? Yes. Amazing. Yes, amazing. Very amazing. Well, that's amazing.
When you level the playing field and remove the each dependent oxidative stress, it's amazing how the body we live in works.
Oh, that's terrible. You're going to ruin the medical industry.
A lot of folks that haven't listened, so they still got plenty of patience.
Australia. I just want
Andy
to
from
say
Australia.
I wouldn't listen to your calls for anything. The whole diary is written round 11 o'clock a.m. Australian time for your call.
And I've got three people over in Australia that I can't get to listen.
Well, give me their numbers and I'll give them a ring and tell them I'll see them up for you.
I don't have their numbers right here.
Well, I'll give you my email, and then you.
Okay, you email me, and I'll mail it to them.
Okay. We're all going to help each other get the word out.
Are you in the Sydney area?
I might be involved, John. I'll hear the nice southern accent you have.
I'm in
Okay.
Queensland.
Great.
Thank you.
Yeah.
You send me an email, ma'am.
I will.
Okay. Bye-bye.
God bless.
Okay, Doc, I think we're going to wrap it up and remind everyone that protandim is not intended to diagnose, treat, cure, or prevent any disease. But protandim does some marvelous things, and I think we've got about 80 minutes worth of stories that kind of bear that out tonight with a lot of different folks that have contributed.
All
So
right.
I'm coming to see you in a couple of days. I'll see you down there in Orlando with a bunch of excited folks.
I see.